Hey you guys, want to hop on with you guys to give you a couple tips to help you if you have a patient with a tracheostomy. So first thing you always want to do with a patient with a tracheostomy is always verify the trach size with the provider's order. So that means that the person's trach is usually going to be in this area, and on the side of the trach itself there's going to be a number. So what you're going to do, you're going to look at the number of the trach that's within the patient's stoma, and then you want to verify it with the order that the provider wrote. Secondly, you want to make sure that you're checking all the supplies in the emergency bag in case something were to happen. You have all your supplies there. You have usually your regular size trach, usually the one that's in the patient or client's neck, and then you will have a downsized trach just in case an emergency were to come up. You have two trachs on site. Make sure you always know where your emergency bag is, what supplies are needed, and make sure that you're refilling it as needed. Third, I would say always have an ambu bag at the bedside. It's so important to have that. If the family refuses to have it at the bedside, please make sure that you're documenting this and also referring it to your clinical nurse manager so they can be aware of the situation. Also, a good tip is too, there are some smaller resuscitation bags that you can get off Amazon if you run into an instance like that. So you want to be well equipped. And then I would say last, make sure that you always assess around the stoma. So like I said, make sure that there's no redness around the neck, there's no signs of infection. So we want to monitor for any discharge, any smelling odor, which would give off signs that there's an infection that's occurring. So I love you guys, and those are your tips for tracheostomy care.